I'm Dr. Marla Shapiro, and I'm a board member of the International Menopause Society. And today I'm joined by Dr. Pauline Maki. Dr. Maki, can you introduce yourself to our audience?
Yes, I'm Pauline Maki, professor of psychiatry, psychology, and OBGYN at the University of Illinois at Chicago.
So today we're going to be talking about a very important white paper that you co-authored called Brain Fog in Menopause, a Healthcare Professional's Guide for Decision Making and Counseling on Cognition. So the first thing that I'm going to ask you, is there a link between menopause and memory problems, or is this aging? It often gets very confusing and confounded.
It's such an important question. It is the case that both menopause and age affect cognition as women transition through the menopause and also after the final menstrual period. The effects of aging on cognition are different than the effects of menopause on cognition, and they can be separated.
So can you separate them out for me? What is the role of menopause for cognition?
So, the role of menopause specifically for cognition is that it appears to have a direct effect on brain systems that underlie our ability to learn new things and remember those things, and also to a lesser extent to attend to things in our environment, to concentrate.
So is this related to estrogen?
It is related to estrogen. So, those memory systems that underlie our ability to encode new information are really sensitive to levels of estrogen and to what we call fluctuations in estrogen. These areas of the brain are really important for our daily lives. What we're doing right now, what we're learning in this video, requires us to learn and remember verbal information. And it turns out that lifelong, women have an advantage in this ability compared to men. So it's not surprising that estrogen plays a role in the ability to learn and remember. And we do studies where we withdraw estrogen, and we can show that these memory centers of the brain change in their function, and that when you add back estrogen, they go back to baseline. So, this is the data that really shows that there's a role for estrogen in memory.
So that begs the question that I think most people are going to have. Is there a role for hormone therapy to treat cognition or prevent changes in cognition? Because certainly it's not an indication that we would think of when we think about institution of menopausal hormone therapy.
And that practice should remain. So, hormone therapy should not be used for the prevention of dementia. Let's talk about this for a little bit because I think it's important, especially given current trends in the use of hormone therapy in certain parts of the world. We know what we should use to protect our brain, ideally from large randomized trials, where a woman just by chance gets assigned to estrogen or to a placebo. So let's go to those kinds of studies. In the best case scenario, the largest randomized trial of estrogen in cognition suggests that in the best case scenario, you would need to treat 2,004 women with hormone therapy to prevent one case of Alzheimer's disease or dementia.
Mhm.
So that means that 2003 women would not benefit. So, for the prevention of dementia, even in the best case scenario, it doesn't make sense, especially given the risks of hormone therapy later in life. Now, where does it have a role? Well, it seems to have a role for the women who have hot flashes, especially those women who have sleep disturbance due to hot flashes. So, a lot of women, 80% of women, experience hot flashes during the menopause. So, is it all women who experience hot flashes? It appears not. Moderate to severe hot flashes are, in our work, reliably associated with poorer memory and also changes to brain structure and brain function. And the good news is that these changes appear at first glance to be reversible. So, for the woman with hot flashes, hormone therapy makes a lot of sense, especially if her hot flashes are waking her up. But for the prevention of Alzheimer's disease, there's really no high quality data to recommend the use of hormone therapy for the prevention of Alzheimer's disease.
And I think that's such an important point for women in terms of thinking of what they can do. So when we look at women often in and around the perimenopause, when they'll come and see a practitioner like me, they'll talk about the concept of brain fog. And is that more related to the fluctuation in estrogen, Will things get better once they're on the other side of the 1 year, where we are now in a menopausal state for the rest of our life?
Firstly, we need to validate these complaints. When a woman says she's having brain fog, we can tell her we have excellent data to show that, in fact, it's not in her head. That if you follow large groups of women over time during the menopause, there is a decrease both in verbal memory and also a little bit in attention. So she's right. This is likely happening to her brain. So validating it. The reason it's important to validate it in this context is because a lot of women think that this means that they're getting demented. They're not. This is a normal part of the menopause. How do we know? Because if you follow women across the menopause transition, that memory recall problem comes back to normal. So it's a temporary thing. Now, for some groups of women, for underserved women in our studies, unfortunately, those issues continue past the final menstrual period. But we think that's because, like many women, they are undertreated for their vasomotor symptoms. And especially underserved women, they continue to experience those symptoms for a long time. So the idea is to treat the symptoms, and then you'll get this improvement in memory performance. Now, there is some idea too that a small amount of the difficulty in learning may continue during the after the menopause transition, but it's not clinically relevant. It's a subtle change that we can measure on our memory tasks. So that's where all of these other lifestyle factors come into play. That's where women should be concentrating their energies.
So I think for practitioners, it's really important for us to get the message that you're really giving us. And I think that you're pointing out the difference that when women come in complaining about brain fog with a concern about moving towards dementia, most women will not. And the concept of adding in some estrogen to prevent dementia is something that we're not endorsing.
That's correct.
So I think that these are really important messages that reinforce what our guidelines are for menopausal hormone therapy, but at the same time, quite reassuring for practitioners to be able to speak to their patients about this. Thank you for joining us today.